Good morning, Amy. My name is Brando Jake. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you say your full name for the record, please?
My full name is Amy Davis.
And what is your candidate number, please?
My candidate number is 251876128.
Thank you. And you are taking this test as a nurse. Is that correct?
Yes, I'm a nurse.
Thank you. Can I see your ID, please?
Sure, here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
Tell us about your approach to dealing with frustrating individuals.
First, I expect to encounter frustrating people and situations. It is part of the job, and I don't allow challenging individuals or circumstances to rifle my efficiency or demeanor. Whether it's an employee conflict, a management issue, or a patient situation, I look to both sides for information and solutions. I find that, if I keep myself personally out of the conflict, it is much easier to arrive at a fair decision.
Tell me about a situation in which you set and reached an important goal.
At my previous position, I managed a team of 7 nurses. The patient satisfaction was around 50%. I let the team know that my goal was to increase that number to at least 75%. I then asked them what resources or changes they needed in order to make that happen. We used a brainstorming session to gather ideas and implemented many of those suggestions. Over a period of 4 months, we were able to increase the level of patient satisfaction to 79%, and the team felt a real ownership in the change, because much of it was a direct result of their own ideas.
How do you cultivate an environment of respect in the workplace?
Respect is an essential component of a successful work environment, and I believe it always starts at the top. While it is important to establish and maintain a leadership role, this can be done with regard for the individual lives and talents of the other workers. I do my best to quickly learn all the names of people I work directly with. I also find it helpful to promote an open-door policy, so that if there is ever a problem, all team members feel comfortable to express it, without fear of retribution.
Describe the personal qualities you possess that allow you to solve tough problems under a timed deadline.
One of the personal qualities that makes me an effective head nurse and problem solver is my ability to step back and see the big picture. In the heat of a stressful moment, the details matter, but so does the overall objective. Another trait, I believe, helps me to succeed is my ability to collaborate. When time is short, you have to work together to reach your goals.
What have you done to improve your knowledge on your job?
I believe that everyone should learn from his or her mistakes. I always try to consult my mistakes with my kith and kin, especially with elderly and experienced people. I enroll myself into a course useful for the next version of my current job. I attended seminars on personal development and managerial skills improvement.
Great. Thank you very much for sharing that. So, let's move on to the role plays now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. The role play will now last for about 5 minutes. Don't worry if I stop you when the time is up. Can you start the roleplay, please?
Good morning. I'm Amy Davis, nurse in charge of the emergency department of the hospital. You seem to be really nervous. If you don't mind, can you please explain to me what is bothering you?
Nurse, I'm dying. Please help me out.
Don't panic. We are here to help you. May I know your name, please?
My name is Brando Jake.
May I know what makes you here today?
I have been stung by many bees while working on beehives on the hobby farm.
Oh my God. Where did you get the stung?
See, nurse, my hands and ankles are swollen, red, and itchy too.
Don't worry, please calm down. We will begin the treatment now.
Nurse, I'm going to die. I can't breathe.
Brando, you are conscious. That is a good sign. Only a conscious mind can recognize fear. Now, I must administer an EpiPen antihistamine injection immediately, and everything will be normal very soon.
You said injection. Nurse, I am terrified of having injections. Please do something else, nurse. I can't breathe.
You might be feared about the injection, but an antihistamine is really inevitable in this situation. This injection will make you comfortable, and they can help reduce swelling, itching, and hives. Kindly cooperate with us.
All right. If you think it is really necessary, please proceed. I have no other choice.
Thank you for your understanding.
Will it be enough to cure my difficulties?
Yes, of course. In a few minutes itself, you can evidence that your symptoms subsided.
Okay. Are any medications to be followed?
Yes, of course, Brando. Please wait for some time to know the medication response in you, and then I'll let you know about it.
Okay, nurse. That's fine.
How are you feeling now, Brando?
Oh, nurse, I am feeling better and comfortable.
Great to know, Brando. From my examination, it is clearly evidence that you have become less agitated now. And also, the swelling is starting to go down.
Yes, nurse. I too felt the same. My itching also reduced to a greater extent.
Okay. So now, what I suggest is to apply this Benadryl cream on the areas of the bee sting. It helps to ease redness, itching, and swelling. Am I clear to you?
Sure, I will, nurse.
All right, if you don't mind, can you please tell me who accompanied you to the hospital, Brando?
I came along with my brother, in his vehicle.
Okay, so I hope he is staying outside, and he will take you back home, isn't it?
Nurse, I'm really sorry to say that, my brother was smoking marijuana before he drove me here. At that time, there was no one else to take me to the hospital. But now, I don't wish to go with him, as he might not be conscious enough.
Oh, I see. I really understand your situation. Don't worry, I will order a taxi for both of you. It will help you to reach home safely.
That will be a great help. Thank you, nurse.
It's my pleasure, Brando. Before you leave, I would suggest that you should get plenty of rest for the next few hours, and remember to apply the Benadryl cream I have given you, as advised.
Sure, nurse. I'll take rest properly.
Great. Besides, if things have not normalized within 12 hours, you must see a doctor for further management of your condition. Are you getting my point, Mr. Brando?
Yes, nurse.
Okay, Brando. I believe I have clarified all your concerns. Do you have any other questions for me?
No, nurse.
All right. If you need any sort of clarifications, kindly feel free to come back. I wish you a speedy recovery.
Thank you, nurse.
You are very welcome.
That is the end of your OET speaking roleplay. All the best.
Thank you. Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.